হ্যালো, হ্যাঁ তোমরা শুনতে পাচ্ছ?
Yes, sir.
তোমরা শুনতে পাচ্ছ?
Yes, sir.
Yes, sir.
থ্যাংক ইউ। শোনো, আমি হলাম ডক্টর গৌতম। আজকে তোমাদের পড়াবো বোন টিউমার, কেমন? তো তোমাদের কি এর আগে কোনো ক্লাস হয়েছে এর উপরে? তোমাদের কি কোনো ক্লাস হয়েছে এর উপরে? বোন টিউমার বা বোন সিস্ট?
স্যার বোন সিস্টের উপর আগে কোনো স্যার লেকচার হয়নি স্যার।
আর বোন টিউমার হয়েছে যেমন
হ্যাঁ স্যার, বোন টিউমার উপর
কোস্টোসার্কোমা এগুলো কিছু হয়েছে ক্লাস? আচ্ছা যাক, ঠিক আছে। তো আমরা বোন টিউমার হতে পারে সলিড অর সিস্টিক, কেমন? যদি সিস্টিক হয় তাহলে বলি বোন সিস্ট। লাইক আদার ডিসিপ্লিন সাচ ইন সার্জারি, সিবাসিস সিস্ট আছে, in the gynecology আছে ovarian cyst, like this. In orthopedic surgery bone cyst also present. Okay, ফার্স্ট হচ্ছে তোমার ইন্ট্রোডাকশন। First হচ্ছে introduction. Bone cysts are fluid-filled spots that form in the bone. You know that cysts contain fluid. It may be yellowish fluid, maybe blood also. Simply, bone cysts are diagnosed simple X-ray. Occasionally, patients may come to us with other problems. Essentially, the cyst is diagnosed simple X-ray. Some cysts have no symptoms. Some cysts which came to us with symptoms such as pain, swelling, tenderness, also other complications. Here we see some cysts. First picture, the cyst is present in proximal femur, latigation. Okay. Also in the distal radius, proximal humerus, and proximal part of proximal phalanx of the ring finger also. Now, simple bone cyst. Simple bone cyst is also called unicameral bone cyst. That means simple bone cyst contains only single cavity. Usually, this cavity is filled with yellow colored fluid. So, simple bone cyst is also called unicameral bone cyst, which contains single cavity. For this, the name is unicameral. Okay. Some cyst also contains multicameral. There is a cyst is divided in many parts following the septum. So, simple bone cyst are a single cavity which is filled with yellow colored fluid. So, a unicameral or simple bone cyst is a common, benign. That means it is non-malignant, non-cancerous bone tumor. Primary affects the children, usually first 2 decades of life. Okay. এখানে কয়েকটা কথা আছে। It is the most common, benign.
স্যার আপনার কথা স্যার বোঝা যাচ্ছে না।
Bone tumor mainly affect the children or adolescents. Although they can
একটা শব্দ হচ্ছে, কথা বোঝা যাচ্ছে না।
আচ্ছা, শব্দ হচ্ছে কি পাশে বলতো? কেউ শব্দ আছে, ওটা আনমিউট করো। হ্যালো, একটা শব্দ হচ্ছে, এক্সট্রা সাউন্ড আসছে, কেমন?
স্যার আমাদের সবার মাইক্রোফোন মিউট করা, কিন্তু আপনার কথাগুলো একো হচ্ছে।
কথা ক্লিয়ার না? হ্যালো,
না স্যার, প্রতিটা কথা একো হচ্ছে, দুইবার করে শোনা যাচ্ছে।
কথা কি অস্পষ্ট?
জি স্যার।
স্যার দুইটা ডিভাইস থেকে ইন করলে হয়তো পারে স্যার।
দাঁড়াও দেখছি একটু। হ্যালো, এখন ঠিক আছে? হ্যালো, এখন শুনতে পাচ্ছ তোমরা?
ইয়েস স্যার।
জি স্যার, এখন ঠিক আছে।
Okay, fine. Again repeat. A simple or unicameral bone cyst. Unicameral means single cavity. Is a common benign. That means non-cancerous bone tumor. Mainly affect the children. Usually first 2 decades of life. Although this cyst may develop in any bone of the body, but especially long bone, such as humerus and femur. So most common site of simple bone cyst is proximal humerus, proximal femur, and most commonly site is metaphyseal region of the bone.
স্যার আপনি মেবি স্যার দুইটা ডিভাইস থেকে মেবি স্যার আপনি জয়েন দিছেন, একটা অফ করে রাখলে স্যার ভালোভাবে শোনা যাবে।
হ্যালো,
স্যার আপনার দুইটা ডিভাইস থাকার ফলে স্যার দুইটা থেকে আমরা যখন শুনতেছি ইকো হচ্ছে।
আচ্ছা রাইট, ঠিক আছে, আমি তোমাকে ই করছি। হ্যাঁ, আমার দুইটা অন আছে, কেমন ল্যাপটপ এবং ইয়েটা আর কি। ওকে, এখন ঠিক আছে? এখন দেখো তো, এখন ওকে?
জি স্যার।
আচ্ছা, ফাইন। তাহলে হলো although it can affect the any bones of the body, most commonly occurs in the long bone, especially femur and humerus. And this most common site is metaphyseal region of the physis of the long bone. Come on. In most cases, this SBC is not painful. Many patients came to us with other region, and incidentally X-ray done, and in X-ray we have seen a tumor. Most cases, simple bone cyst came to us without any symptom, and usually diagnosed simple X-ray. And occasionally, this tumor or cyst with weakening of the cortex and causes a fracture of the bone. Many patients came to us with fracture. Following X-ray, we have seen that there is a cyst. The cause of simple bone cyst is unknown. Simple bone cyst occurs due to outgrowth of the growth plate. এখানে কয়েকটা কথা আসছে যে usually this is symptomless. Patient came to us with other region, and incidentally the patient is diagnosed simple X-ray. And occasionally patient came to us with fracture, but after X-ray we have seen that there is a tumor. The cause of simple bone cyst is unknown, but some theory suggests that it may be occurs due to outgrowth of the growth plate. Now classification. Simple bone cyst or unicameral bone cyst can be classified into two categories: active and latent. In active type, this cyst occurs near to epiphysis of the bones and grow to diaphysis, and it may be filled follow the diaphysis. It's called the active cyst. In active cyst, this cyst is close to the epiphyseal plate and grow to the diaphysis. It's called the active. And latent cyst, this is away from the epiphysis, and it is usually resolved, or usually it is treated simply. Okay. So classification, two types of simple bone cyst: active and latent. Active bone cysts are near to the physis and grow up to diaphysis. Occasionally, whole bones, that means whole diaphysis may be involved. But in latent cyst, this is away from the epiphysis and it is easily to treatment. Symptoms and sign. Again, usually simple bone cyst has no symptom, but patient may came to us with simple pain, swelling, reduced movement, and maybe fracture. So simple bone cyst usually asymptomatic, but patient may came to us with pain, swelling, reduced movement, and fracture. Here you see some picture. Cyst is the proximal femur. Cyst of the proximal humerus. You see that very thin is my cortex is very thin, and here a cyst is present in the proximal humerus, and there is a fracture. Again, some cyst may be present with us with a fracture, and also cyst present in the fourth toe, proximal phalanx. Okay. Next, diagnostic method. Simply, we can diagnose simple X-ray. That means medical imaging. To confirm a diagnosis of unicameral bone cyst, imaging test can be done post X-ray. In X-ray, we see a central important point. Simple bone cyst is always occurs in the central position. Oil margin, relucent defect in the metaphysis. তিনটে কথা আছে এখানে: central, oil margin, and metaphysis. Simple X-ray, we can diagnose the simple bone cyst. DD of simple bone cyst. First, fibrous dysplasia. In FD or fibrous dysplasia, the cyst occurs in the eccentric position of a bone, but SBC was central, and FD mainly occurs in the diaphysis, then metaphysis. এখানে দুইটা পয়েন্ট আছে এখানে যে FD, the cyst occurs in the central, not central, it is eccentric, then central, and it is occurs in the diaphysis. And FD can occur in adults. It can occur in children or adults, but simple bone cyst occurs in children. Type 2, another bone cyst. This bone cyst is mainly occurs in the eccentric. Next 3, GCT, giant cell tumor, important tumor of the bone. In GCT, usually occurs in the older children, that means after 20 to 45 age, and in giant cell tumor, this tumor extending up to the articular surface. Next, interosseous lipoma. We know that lipoma is a universal tumor which can occur in everybody, every side of the body, but interosseous lipoma is a DD of SBC. So there is 4 DD: FD or fibrous dysplasia, another bone cyst, giant cell tumor, and interosseous lipoma. Treatment. Treatment is often supportive, as because this tumor is automatically healed following skeletal maturity. So treatment is supportive. This tumor can be automatically healed during skeletal maturity. Number 2, injection of steroid. Percutaneous injection of the steroid has been reported with varying success, but is based in activation. আমি বলেছিলাম যে 2 type of SBC আছে, active, latent. Active SBC is present of tumor in the proximal near to the epiphysis, and it is extended to the diaphysis. So this injection is most effective in activation. Number 3, curettage and bone graft may be required in areas at risk of fracture. যদি আমরা দেখি example is a tumor which causes thinning of the cortex may prone to fracture, then keratase and bone graft can be done. Number 4, if there is highly risk of the fracture of UBC, surgical treatment is necessary. To देखी जे following tumor which may causes fracture of the bone, then surgical treatment can be done. Number 1, keratase, bone graft, and fracture fixation. So আমরা simple bone cyst আবার review করতে পারি one time. Simple bone cyst, most common non-cancerous tumor which may affect most long bone of the body, especially humerus and femur, and it is occurs metastasis of the long bone. It is central well margin tumor. Usually a simple bone cyst came to us without any symptom, but patient may come to us with fracture, and following X-ray we have seen that cyst was present here. But many patients come to us with simple pain, swelling, and fracture. Most complication of simple bone cyst is fracture. Treatment is simple. Usually it is automatically healed following scleral maturity. If we see that huge size of tumor which has prone to causes fracture, then surgical treatment can be done. 3 options: keratase, bone graft, and fixation of the fracture. This is merely all about of simple bone cyst. Simple bone cyst is also called the unicameral bone cyst, as because it contains it consists of single cavity. For this reason, it is called the unicameral bone cyst. Next topic is aneurysm থেকে আসছে aneurysm bone cyst. Aneurysm, already you have to know what is aneurysm. Aneurysm is a tortuous bulging or dilatation of the vessels. It's called the aneurysm. This term থেকে আসছে aneurysm bone cyst. In surgery, we have known the aortic aneurysm, which is the rupture of the artery, causes acute emergency of the patient. So this term, it is one of the bone cyst. This term comes from aneurysm, aneurysm bone cyst. So ABC is a non-cancerous, like SBC. It is a non-cancerous, that is benign tumors composed of multiple varying space and filled with blood. এখানে কয়েকটা কথা আসছে যে it is also called the multicameral. That means it is also called the multicameral, a single cavity term. And this is SBC and ABC. In SBC, it has a single cavity and filled with yellow color fluid. But in ABC, it is also called the multicameral. That means single cavity divided in multiple cavities by septa, and this cavity is filled with blood. And this ABC is filled. It is components of pain and swelling of the bone. Usually, ABC patient is came to us with typical symptoms: pain, swelling, maybe fracture. ABC causes pressure effect of the neighboring viscera or organ, causes neuron problem. Here you see some picture of ABC. This proximal fibula, proximal femur, and here you see the fracture. And this fracture is treated by proximal femoral nerve plates by screw. So SBC also came to us with fracture. If patient came to us with fracture, it should be fixed by pillar and screw. Also see the distal radius and distal tibia. Classification. ABC can be classified into two. This is simple or primary and secondary. In secondary ABC, is accompanied or coexisting with other lesion. Or the secondary ABC can be coexist with other lesion, other tumor, such as osteoblastoma, osteosarcoma. But in primary ABC, single bone cyst. In primary ABC, there's no corporation with other tumors. So primary ABC, only single bone cyst, which is not coexisting with other tumor. But in secondary ABC, this tumor can be coexist with other tumor, such as osteosarcoma, osteoblastoma. This common age and location. ABC also common in children and teenager children. That means first 2 decades of life. ABC can occur in any bone of the body, but it most commonly occurs in the knee, pelvis, and spine. আমরা আগে বলেছিলাম যে simple bone cyst mainly occurs in the long bone of the body, especially humerus, femur, but ABC can occur around the knee, pelvis, and spine. If ABC is untreated, this type of tumor can cause nerve damage or paralysis. So common age is children, that means first 2 decades of life. Most common site knee, pelvis, and spine. If left untreated, which causes nerve damage and paralysis. Sign and symptom. Usually, ABC presents with the symptom. Most often, the symptom that is pain is the most common symptoms of ABC. In other patients, when the cortex is so thin, so ABC can be diagnosed following X-ray, following fracture. If ABC can occur in the skull or spine, which may cause different in other disease complications. Cause of ABC. The cause of ABC is unknown, but presently the most commonly theory is that increased venous pressure, which causes dilatation and rupture of the local vascular tract. Like SBC, recent studies show that increased venous pressure causes dilatation and rupture of the vessel network. When the ABCs occurs in secondarily, that means some tumor which may accompany with ABC, such as DCT, chondroblastoma, osteochondroma, and fabric dysplasia. Diagnosis like SBC, ABC can be diagnosed simple X-ray, and occasionally CT scan may need. In X-ray and CT scan, we see the lytic lesion, lytic expansion lesion in the hilar border, and expansion of the cortex, the ballooning of the bones, which causes bone fracture. And bone scan also can be done. So if we do simple X-ray, we can easily diagnose of the ABC. DD of ABC is unicameral or simple bone cyst, giant tumor, and secondary ABC. It is DD. Treatment. The lesion may, when the lesion is more rapidly progression, which may causes easily automatic results by trauma or fracture or biopsy. Occasionally, This it is a aggressive tumor, but it can be easily spontaneously treated by trauma or fracture biopsy. Occasional curettage can be occurs during biopsy, and for recurrence or to prevent the recurrence, we can use liquid nitrogen, phenol, or bone cement to kill the margins of the tumor. Prognosis in 20 to 7% cases, tumor can be recurred after curettage. Next, if we difference between the SBC and ABC, আমরা simply divide করতে পারি দেখো যে simple bone cyst and ABC bone cyst both are benign tumor and both are present in the children. It is common picture that SBC, ABC both are benign. That means non-cancerous and mostly occurs in the children. That means first degree of life. Point two, simple bone cyst is filled with fluid and it is unicameral. That means single cavity. But in ABC, it is a multiple cavity and it is filled with blood. Unicameral bone cyst can occur in the all bones, but most commonly occurs in the long bone. And ABC can occur in the any bone, but most commonly occurs in the pelvis and the spine also. And simple bone cyst is central location, well margin, but in ABC, eccentric margin and bulging. In simple bone cyst, there is no secondary, but ABC has secondary. In simple bone cyst, patient may come with simple without any pain, but ABC come with pain. Next, recurrence. Recurrence rate of SBC is 26%, and recurrence rate of ABC is 22 to 70%. This is all about. Thank you all. Okay.